To our listeners this morning, I want to introduce our weekly podcast sponsored by OCO Biomedical. My name is Dr. James DeLeese, retired clinician, over 40 years of implant dentistry, and I'm delighted this morning to have Dr. Ghaboussi, who is a very active general practitioner focusing on dental implants. Good morning, doctor.
Good morning.
What we are anticipating and speaking about this morning are some of the things that are most important in building an implant practice or a practice in general. And that's what we intend to do every week, is to bring different doctors like yourself who can help other doctors with information about how to grow their practice. Today, the topic is going to be patient financing. And that, I'm sure, is dear to every implant dentist's heart. This is not, doctor. So if we might start out, explain to the audience your feelings about implant financing for these patients.
So, I think this is one of the most important and misunderstood aspects of implant dentistry, because we live in a consumer driven world, and yet dental offices typically are not very consumer friendly. And from talking to dentists, what I find is they feel like they're very consumer friendly, but in actuality, they aren't. And that's a lesson I learned from my wife, who's much smarter than me at this stuff. So, in going around the country and teaching classes and things like that, I got to talk to a lot of dentists. And when I talk about making, helping patients pay for their dentistry or helping make your office more consumer friendly, there's a lot of it seems like there's a lot of misunderstanding around what I'm saying. So I think today is going to be probably one of the most important podcasts that your listeners have heard. And especially if they're not doing these things that we're going to be talking about today. And it's probably the easiest way to have an impact on a practice's bottom line and really help your patients move forward with treatment. Very
good. I would like to discuss, and during the course of your informational dialogue on financing, I like to look at it as the good, bad, and the ugly.
Good movie.
Yes, the good, bad, and the ugly of financing. I'm using financing companies. We all have had the good, we've all have had the ugly, and we've all had the bad. And hopefully we can touch on a little bit of that to give our listeners, our practitioners, some heads up on what troubles and things that they may encounter from some of these financing companies. And I know that you'll dwell on that a little bit, but let's go forward. Let's go forward and define patient financing.
Well, so anytime people spend a significant amount of money in this country, they typically finance it. If you go buy a TV or you go buy a couch or anything like that, one of the first things they probably ask you, the salesperson would probably ask you, is, would you want to finance this? And of course, when you buy something online, a lot of times you're able to finance it through the site that you're buying it from. And so in dentistry, traditionally, there's been a few big players in patient financing. And those, most people are familiar with something called Care Credit. And Wells Fargo, even before Care Credit came along, a bank named Wells Fargo had a dental branch or a dental arm that offered patient financing as well. And the appeal of this to the dentist is you get paid right away. The drawback is you end up paying, a pretty significant fee to Care Credit or Wells Fargo. The other drawback is, or the other benefit to those things is you get paid right away, and they're also non-recourse. So if the patient defaults, Care Credit and Wells Fargo don't come after the dentist for the fee. These days, if you fast forward to current times, there are many players in that patient financing market. And I don't even really want to talk about these ways so much because, but so now if patients want to finance larger amounts, $30,000, $40,000, things like that, there are financing companies that will do that for a dental office and a patient, but you have to be careful because some of them are not no recourse, meaning if the patient defaults on the payments, they come after the dentist. And so that is not a good situation to be in when you've, put all that heart and sweat into helping a patient and then you end up paying for their case too. That's not a way you want to go. So you want to be very careful if you're looking at joining some of these patient financing groups or using them for your office, that they're non-recourse, so that if the patient has something that happens to them and they default on their payments, it's not going to come back on you. And that's a nice thing about something like CareCredit or Wells Fargo. Those aren't really good for $30,000, $40,000 cases, but they're really good for smaller cases, up to maybe a few grand, 3, 4, 5 grand, something like that. But these days, patients are much more savvy about their finances, and they understand it's just another line of credit. A lot of patients don't want to move forward with CareCredit, even if they qualify. Or you may have patients that don't qualify for CareCredit that have been really good patients and you have trust in. So how do you move forward with those situations? And for me in my office, we do use CareCredit. We've also used Wells Fargo in the past. I don't mind paying them that fee. The way it works is patients get a no interest payment period of up to 12 months usually, and it's a little different depending on what program you're in. But essentially then the dentist is paying the interest on it. So they take a percentage, 3 to 5% or whatever it is. And I don't mind paying that. You get paid up front, and it's a nice way to help patients move forward with treatment. But a lot of patients these days, they understand it's just another line of credit. It's just basically like another credit card. You can use it at the vet. You can use it at the eye care place. And they're not really interested in that. And
Have you ever had a situation using the CareCredit or any of the other financing companies where you make a good point that the paper is non-recourseable, which does not go back to the dentist? However, have you ever had a situation where the patient stopped treatment in the middle of treatment or at the prosthetic phase for whatever reasons? Whatever reason, could be they lost their job or whatever, but they stopped treatment. Under those circumstances, my experience and from listening to other doctors, if the situation couldn't be ameliorated, the financing company would take the balance of what was owed to that company right out of your account. Have you ever had that experience?
I haven't had that experience, but if there's a problem with the patient and they can't finish treatment, I don't want them paying for something they're not going to get either. So it's never gotten to that point, just because I think we're very good at handling things in a way that's acceptable to both the patient and our office. What we have had though is we've had patients be upset about they miss a payment, and then companies like CareCredit, they charge you interest going back to your first payment,
Absolutely. Yes.
So we did have that once. It was a situation though, it was a strange situation where the bank, they had the payment set on auto. The patient had their checking account set on auto pay. And for some reason it was in there, but the bank didn't send it out. And so the patient came in very upset that, that this happened, but they understood, because we're very clear in the beginning, you have to be careful about making your payments on time. And we have the patient sign the paperwork that comes with CareCredit, but we also have a separate sheet that bullet points these things. So we go through it with them and have them sign that too. So they understood, but they were just very upset about it. And what happened in that case is the patient's bank reached out to CareCredit and they reversed the charges for them.
Were you ever told to, or perhaps you did this, to keep a separate account for that patient, like a law firm, like a client account? Because what usually happens, as most practices, the income that you receive, whether it's through care credit financing or patient payments, goes into your general fund, and before you know it, you're paying bills and salaries and everything else with it. Have they ever said to you, maintain a separate account and only draw down from that account what you do for the patient?
No, I've never heard that, but for us, it just hasn't really been an issue. So,
Okay.
and we've been doing it. I've been using Wells Fargo since about 2001 or 2000, and Care Credit
Okay.
since it came out, which is almost as long ago. But we just never had issues with it. I think as long as you're clear with the patient, and if a situation, an unfortunate situation comes up where the patient dies or something like that, and their family requests a refund or whatever, which I've heard of also, we would just try to be reasonable with them, and I would probably take my lab fees and overhead out and refund the balance.
Okay. That's good.
I think the main thing is to go forward with goodwill whenever you're dealing with patients, and hopefully you won't have problems. The goal is, we care about them and want them to have a good outcome, but it has to also work for the business. You can't do work for free,
Sure.
And that's what brings me to this next idea, which we found it really helpful because we've had a lot of patients that don't want to use Care Credit or something like that. They don't want the hard check on their credit, or they don't want they don't want other things to happen. The nice thing about Care Credit is that you can do a pre-approval without pulling the patient's credit, so it won't damage their credit score. So what every office should do when they have a new patient come in is just see if you can pre-qualify them for Care Credit. And then if they need something, it makes it very easy to offer them, that as an option. If they need $1,000 worth of treatment or something, then you can give them payment options, and you can include that as one of them. And that you can do that without even messing with their credit. What a lot of patients don't want is they don't want to actually go through with it, because what Care Credit will do then is they'll pull your credit when you want to access the money, right? So you can get a pre-approval with no credit check, but for sure they check your credit before they send money to you. So a lot of patients don't want to do that anymore. The consumers become much more savvy. So then what I talk about is having some kind of in-house payment plan, right? Where, and this is what gets a lot of people, because you hear your entire career, don't become the bank, don't lend patients money. But I think that's wrongheaded in a lot of ways, because we've been doing it successfully since we opened our practice in 2009. And it's changed a little bit over the years, and I can fill you in, but I understand a lot of dentists hear that in-house payment plan and they balk. And I don't know how you feel about that, but it would be interesting to hear your opinion on that.
Well, you see, one of the benefits of being an implant dentist, we have a built-in mechanism right in our procedures that allow for you to finance a case. For instance, bone grafting and osseointegration. You're in for 3 to 4 to 5 months. Many of these cases run 6, 7, 8. Many of them go a full year, which gives you the ideal opportunity, if you want to take that case, to spread the payments out over 3, 4, 5, 6, 8, 10 months while treatment is happening. And I always felt that osseointegration was a benefit for everybody. It gave everybody enough time to back away from having immediate payment, unless you want to, immediate load the case or whatever. But the idea of just having that patient wait for integration to take place, whether it's on a bone graft or implants, ideal time to set up a payment plan.
Yeah, there you go. It's almost something like that. This idea is almost custom built for implants, but it works for other things too. So what a lot of dentists will say is, well, what if the patient doesn't pay? And that's what they're worried about. You know, what if they try to screw you over or something like that? And so, you know, if that's the case and you're having problems with that in your dental office, then it probably means you have a different type of problem. And that problem is not making firm financial arrangements, which every dental office should be doing. And if you're having problems with patients stiffing you on the bill, most likely, or you're having problems collecting, most likely it's from not having somebody create firm financial arrangements that the patient signs ahead of time. The other theme that comes from that is, well, you know, if you're doing payment plans, you know, patients will forget what their deal is, what they're supposed to do, and then they won't pay. And so I don't like the idea of having patients pay with a check or with cash or things like that. It has to be on a credit card that you keep on file, and they sign off on having specific set payments each month. And it has to be done in the beginning before treatment started. And so to do this and help make it easier, so when I've been to other dental offices and talked to dentists, a lot of them will have a practice management software like Dentrix or EagleSoft or things like that. And it'll print out a sheet that shows what the patient, what the fee is, what the insurance discount is, what the patient's portion is, and so on and so forth. And it'll line item every single thing. And when you look at that, it's super confusing to patients. So many dental offices will just do that. They'll print that sheet out and give it to the patient. And the patient looks at that and they get confused. And you know what? My father-in-law is in sales, and he always says, confused people don't buy, right? So you could have a patient that's really wants your treatment and they need it and they think you're the person to do it for them. But if you confuse them when it comes to arranging the payments, they're going to move on and go somewhere else. So you have to keep it really simple. Never show patients that printout sheet from your practice management software. What should be happening is whoever's in charge of creating the financial arrangements should set the treatment up the way it's supposed to be in your software. They should print out that sheet and initial it so you know who created that sheet, and then scan it into their document center in the software so you have something to look back on and see where all the numbers come from. But don't show that to patients. That should just be an internal thing so that you can track where the numbers came from and who did it and so on. So if there's a problem, you can always look back and know, oh, this person did it. And you can go to that person and say, why is it like this? You know, things like that. So that paper, then you use the numbers from that. The person who creates the financial arrangements puts those numbers into an Excel file we created, or you can create as well, that will have at the top, it'll have the practice name, the patient name, what the treatment is in general. So maybe implant, abutment, and crown, tooth number 5, something very generic, right? And it'll have the total cost that you put in, the insurance discount, the estimated insurance discount would be on a line next to it. And then the patient's portion would be under that. And so since it's in an Excel file, it just generates that patient portion for you. And then below that, it offers all the different ways to pay. And in Excel, you can put in the formulas so that it'll automatically calculate out those ways for you. And so there's, you know, if the patient pays their portion, prepays their portion in cash, they get maybe a 2% discount or whatever. So there'll be a line that says that. They can do care credit if they pre-qualify, and it'll automatically calculate what their care credit payment will be. Or they can do our in-house financing, in which case, and we can go through that later, but it'll calculate out what the monthly payments for that would be as well. And so this Excel file is very simple. because the patient can see, oh, here's the total, here's what my insurance is putting into it, and then here's my portion. And I can pay that portion all at once, or I can have these other ways where I can see the monthly payments. And what we forget is, in our country, most Americans have no savings. So I'm amazed at how we have patients that won't move forward with treatment over something like $150. But a lot of people, that cleans out their their checking account. Where if you're able to do something like this, they can see, oh, I can do $75 a month for 4 months. And it just makes it very easy to help patients move forward and to understand how they can afford treatment. So never show patients that printout from your software. Always simplify it for them, so that it helps them move forward with treatment. And it makes it more simple for the team to present treatment as well.
If you did not have, or if you had a patient that did not have insurance, or their insurance that they did have did not cover your procedures, what type of percentage or would you ask for a down payment to begin treatment?
Well, so that's a very good question. So first of all, you want to be careful if you're doing in-house financing. So if you have a patient that historically has not been good at paying or showing up, if they've shown themselves to not be very trustworthy, you want to take that off of the table and not offer them the in-house plan, because they, if they've already shown themselves to not be a person that is going to be reliable to you, you don't want to go lending them money, right? But if for patients of record that have shown themselves to be reliable and good patients, it's up to your office to decide what you want to do. And so what I recommend is start it off by being a little heavier in the front end, right? So if someone comes in, and let's just stick to round numbers for examples. These aren't real numbers, but these are just to help understand. So say a patient wants an implant and you charge $1,000 for an implant. And I know that's not realistic, but I'm bad at math, right? So at the time they make the appointment, or the time they sign up and make the appointment, they would put down 30% or 35% or whatever your office deems is reasonable for your office, right? And in the beginning, be somewhat conservative with this, right? So that would be, say, 35%. That's $350 that the patient would put down at that appointment. And then you would split the remaining over whatever period you're comfortable with. Say it's 4 months or 5 months or 6 months. And so that Excel file will automatically calculate that out, right? So if you decide that you want to start out with something like this, and say that the patient will pay 30% at the time they schedule the appointment, not the day of the appointment, the time they schedule the appointment. So they would put down $300, and the remainder would be $700. And that first, and then from then on, every month they'll pay the remainder. So what would you say, 4 months? So you put an implant in, it's reasonable to wait 4 months, I feel like, right? And so they would pay $175 a month on their credit card. And it's no interest to the patient if they're paying it off every month, right? So essentially, they get to use their miles on their credit card. I know everybody wants to build up their miles, right? Or get points or whatever. I have a credit card. Most families these days will have a credit card they use to get miles or points or whatever. Maybe they want to go to Disneyland and they have a Disney card or whatever. And so what we found is people are much more likely to choose the in-office option than the care credit option, because they can build up their points or whatever, it's still no interest. And they don't have to apply for another card or risk, having another credit check pulled.
Are you charging any interest to carry their balance?
No, and obviously I'm not a lawyer, an accountant, or anything like that. But I feel like I think if you decide you want to charge interest, there's other loopholes and things you have to go through. And my goal for this is not to make money on a patient; it's to help them move forward with treatment.
Sure.
And so there, it is, the risk is all on me and none on the patient. And I understand that bothers some people, but for me, charging interest would take it from being something helpful to move for, it ends up, it ends up adding in so many potential headaches.
Good. That's a good point.
Yeah.
I guess to finalize this financing aspect of the practice, how do you handle shoppers?
So, like I said, I would not offer this to most new patients that come in, because you have no relationship with them, right? Once they've been in, had their teeth cleaned, and you get a feeling for them, then you can offer them this. So if your office doesn't have a person that does the financial arrangements, if everybody does them, then you have to be very careful about this, because not everybody is a good judgment of human nature and finances and things like that. Somebody comes in and they can't afford $30 for x-rays. You don't want to offer them $175 a month payment plan for a crown, because they've already said they can't afford the $30, right? So you just delete that out of the Excel file. If they qualify for care credit, you can go ahead and offer them that, and maybe they'll show that they can do those payments on that, and then later on, if they need something, you can offer that in-house financing to them as well, right?
Yes.
But if it's somebody you don't know, they don't qualify for care credit, well, care credit just did you a favor and gave you a free credit check, essentially, right? Mm-hmm. But we have a lot of patients that don't qualify for care credit that do really well with these in-house plans. And
sure.
And a lot of people that do qualify for care credit that don't want to use it. They want to use the in-house plan so they can get their points on a credit card that they already have. And it's not just implants that this is good for. And as time goes on and you implement this in your office and you get more comfortable with it, and your team gets more comfortable with it, and you may decide to offer longer terms. Maybe you decide to offer 6 months or even 12 months. But you want to make sure that when you do this, the rule has to be that it has to be on a credit card, not on a debit card, because a debit card is basically linked to someone's checking account. And we already know Americans aren't savers, and they're not good at, typically we're not good at, balancing our checkbooks. So if somebody puts this on a debit card, it's possible that they may spend all the money in their account, and then every month your payment's not going to go through, right? And then you're going to have to follow up with these people continuously, which defeats the purpose of simplifying the whole process. And so initially when we did this, my wife hated it. I work with my wife, and initially when we did this, there was no credit card processors that could do automatic payments. And so what we would do is we would have the Excel file, and then what she would have to do is have a list that she would manually run each month, which is incredibly time consuming, right? So now I learned from another dentist named Tarun Agarwal. He teaches digital dentistry. I learned that what he found was that now there are credit card processors that will set your business up with like a little website where you can do automated payments for patients. And so what happens is you just put in the amount of each monthly payment, how long, and it'll just automatically run the credit cards. And then each morning it'll send you a report. If someone's credit card doesn't go through, then the person that does your financial arrangements can easily follow up with just those people. And so that makes the process much smoother. And you know, my wife is the one that initially wanted to do. We've been doing it since we opened our practice in 2009. And once we heard that from Dr. Agarwal, he goes by T-Bone. Once we heard about that from T-Bone, we looked into it, and sure enough, there was a credit card processor that we could use that would do that. So it makes it absolutely fantastic.
This conversation that we're having this morning absolutely is essential to every practice, because as you know, and as we've often said, going through dental school, we never had any business training at all. But a substantial part of the success of our practice is built around the business aspect. And you have brought to our listeners some very valuable lessons and thoughts about how to get that very important cash flow business stable and continuing to grow. Doctor, we thank you very much for spending the morning with us. We look forward to having you again join us in our podcast. And our podcast is all about bringing ideas, concepts to the practitioner to help them negotiate through some of these very difficult times.
Well, thank you, Dr. Jim. If you want, we can put my my forums on the O Club or something for people to download. They're not, you know, none of this is anything that I invented myself. It's all things that I learned from somebody else. So I'm happy to pass that on if you want to.
Yeah, very much
make it available to the O Club members.
Yes, every time that we can share information through the O Club and through our chat rooms, it enhances someone else's ability to negotiate a problem they're having. None of us want any of those problems. We want to listen to get corrections from other people. You've done a wonderful job, and you're a great practitioner and a great guy. And I really appreciate you coming on to share your experiences in our podcast. We look forward to it. This is a podcast that goes on every week. And every week we have different thought leaders helping us negotiate through growing an implant practice. Thank you. Thank you very, very much, Doctor, and you have a great day.
You too. Thanks, Dr. Jim.
All righty. Take care now.